Hello everyone, welcome to HIM 103. This is going to be an orientation for HIM 103 and it is a requirement for this course. I'm going to take you through Blackboard, through the course in Blackboard, as well as demonstrating the coding, the encoder software for you. There will be additional lectures for you specific to using the encoder and specific coding assignments that you will have throughout the semester. When you log into Blackboard, obviously you have seen your course HIM 103 and logged into this particular course. When you log in, you will always land on the announcement page, and it will be very important for you to pay attention to and read the announcements that your instructor posts. Typically, they're very specific to an issue with the course or a question that has been asked by a student, or the instructor is relating information to you about recorded lectures or assignments. Laura Herbert is your instructor for this course. You'll notice that we do have information on how to disable the pop-up blocker in both Chrome and Firefox, and we actually recommend that rather than Internet Explorer that you use either Chrome or Firefox in this course, and both of those are free and they can be downloaded. The second tab in the navigation panel over here on the far left is contact information and an introduction from your instructor. Office hours are online. That information is posted here for you. However, from within the course, you certainly may email this instructor anytime you have questions, and she will be glad to email you back and address those questions that you have. The next very important section is the course syllabus and information. The syllabus for the course is listed here. You click on this document and it will open for you. The course schedule and plan of instruction is a week by week listing of what you're required to complete each week in the course. Assignments are due on Sundays by midnight, and we strongly recommend that you do not wait until Sunday afternoon to log into a course and look at what your requirements are for the week. A word of caution, if it's Sunday afternoon or Sunday evening and you're having technical issues or difficulties, you may have a difficult time finding someone that can help you with those issues. So we strongly suggest that you log in frequently during the week, look at what you need to do, and have your plan for getting those assignments completed. Once you've reviewed the course syllabus and the plan of instruction, you need to go in and complete the syllabus and course schedule compliance statement for us. And then we have some documents that are going to be applicable to you taking this HIM course. The academic misconduct policy is actually the college policy. Our online attendance requirements require that you log into the course and actually complete coursework in order to be counted as in attendance. At a minimum, you would have to complete a discussion question. If there's not a discussion question for that particular week, then you will need to complete assignments. Just logging in and looking around does not complete the attendance requirement for this course. You actually must do work. When we're looking at the attendance requirement for the college, if you are not in attendance either of the first 2 weeks of class, you will be withdrawn from the course. And if you exceed 20% of the missed hours for the course, then you will be withdrawn from the course. It will be extremely important for you to contact your instructor before assignments are due if you're having an issue or a problem, or if there is some reason that you cannot complete assignments. And it's at the discretion of the instructor to grant you an extension. With our assignment submission policy, if an assignment is 1 to 3 days late, we deduct 15 points from your grade for that assignment. If it is 4 to 7 days late, we deduct 50% of your grade for that assignment. And if it's 8 days or greater late, then we do not award any credit for that. Of course, the exception is if you have contacted your instructor and let her know that you're having an issue and you need an extension, and then typically the instructors are very good about working with students. So we've had students who have been in the hospital, who have been in accidents, who've had sick children, any number of things, and we're happy to work with you as much as we can to meet the requirements for the course. We have included the AHIMA Code of Ethics and the Standards of Ethical Coding. The AAPC also has codes of ethics related to coding. These are instructions on how to disable the pop-up blocker in both Chrome and Firefox. And if you are a student with disabilities, this is information for you as well. When we go into course content, first of all, you have some information on getting started with MindTap, and then also Cengage technical support. Let me log in. When you click on these icons, this information pops up. Now, this is the book that you're using for this course, Understanding Medical Coding. It comes with a MindTap access code, and then you're also going to be purchasing the Encoder Pro software for this course. So when you initially log into MindTap, you want to click on Redeem Access Code. You'll put in your access code, and then you'll have access to the course without any issues. You can choose I'll pay later, go to my course, and the software will let you in for a few weeks before it finally says no, you have to use an access code. Once you get into the course, you're actually going into Cengage software and you're reviewing the content of the course here. Of course, it correlates completely with your textbook. Your assignments will be in MindTap. Your tests will be in MindTap. If you purchased a used book and you did not get an access code with that used book, you can choose the option to pay online with a credit, debit card, or PayPal and pay for that access code. If you have any questions or any problems with this at all, be sure and let your instructor know. So we have course content for each of the chapters in this particular textbook. You have discussion questions. Discussion questions are required, they're graded, and they can impact your grade in this course if you don't participate and complete them. We ask that you go in and introduce yourself to your classmates. If you have questions about the syllabus or the course schedule, you can post those questions here, and your instructor will be glad to answer those, but we actually encourage you to email the instructor directly through the course if you have any questions about the syllabus or the course schedule. And then you can see that typically each week there are discussion questions, and you need to participate in those discussion questions. Your assignments, which are listed in the course schedule and plan of instruction, can be accessed in this assignment tab, and they're listed by week. So for instance, if I go into, they're listed by chapter. Into chapter 1, you're going into Cengage to complete a case study. And typically this is what you'll do for each of the chapters that are listed in your course schedule. You do cover more than one chapter in each of the weeks, so you'll need to make sure that you don't assume that week 1 only covers chapter 1, week 2 only covers chapter 2, and so on and so forth. I do want to always scroll down when you're on Blackboard. I do want to point out to you that in week 13, you're actually going to be completing health information management assignments. You're going to be going into web links and finding a document entitled HIPAA, clicking on that web link, and then completing this assignment. And the same thing with some of the different HIM professional definitions. You're also going to be going to AHIMA's website. AHIMA is the American Health Information Management Association, and that is the professional association for HIM professionals. It's an excellent website, great information. They have a section just for students, and one of the documents included there is called a career map. And it is a great tool to help you view all of the different types of professions available to HIM professionals and what the educational path for those professions would be. And then it also gives you sort of like job descriptions and things like that. So you can see if any of those are professions that interest you. And then you also have CMS web-based training. So in your final week in the program, you will actually be logging into the cms.gov website and completing these web-based training courses. And you have a link that actually includes instructions on how to get into this web-based training. You will actually have to set up a username and a password. You can start these and then go out and then go back in and finish them up. One of the things I hope you'll notice is the wealth of information that is available at the cms.gov website. It's very specific to the hospital setting and then to other non-acute care settings, and particularly for the physician office. And I strongly encourage you to look at all of that information available on the cms.gov website. cms.gov is specifically designed for providers. Medicare beneficiaries have a website called Medicare.gov. So for your patients that have Medicare, Medicare.gov is where they should go. And it has great information for beneficiaries. And as a provider or working for a provider, much of that information is in layman's terms, so it's easier to understand than the cms.gov website. So I strongly encourage you to explore both of those websites. You do have tests in this course, and you'll access those through tests in the navigation panel, or when you click on My Grades, you are able to see your assignments and the due dates. You can see the due dates for your assignments listed here. So that's also very helpful for you as well. And they should all be in chronological order, so it's easy for you to scroll down and find assignments that are due. Once you've submitted an assignment, you'll be able to tell by looking in the Grade Center that you have submitted it, and once it's graded, you'll be able to see your grade for that assignment in the Grade Center. You should be able to see your average in the Grade Center, and then the grading criteria is listed here for you. This corresponds to your course schedule. The final exam is 20% of your grade. Your assignments are 20%. The CMS web-based training is 10%. Discussions are 10%, and your tests are 40%. You can, if you're going to email your instructor or email other students, you would click on student email, and then you have options here. You can email all users, which would go to all the students and the instructors. You can choose all student users, all instructor users, or you can select a specific user that you would like to email. And this is the preferred way of communicating with your instructor. If you have a question for your instructor, we strongly just stop right then, send them an email. And usually you should receive an email back from your instructor within about 24 hours. You have a link for student resources. Take some time to peruse this link, which has great information for you about Blackboard and the college, and different resources for you. And then these are the web links. So at the time that this course was built and at the time of this recording, these web links all worked. If you click on a web link and it doesn't work, let your instructor know right away, and we will go in and get that link fixed. Now I'm going to demonstrate for you the encoder software, and you will have purchased a code for that, an access code. We ask that you not access the Encoder Pro until you need to, because you have like a 90-day access code, and we don't want your access code to expire before you finish this course. So don't access Encoder Pro until you need to use it. What I want to, you'll see the address up here, www.encoderpro.com. Once you get to that URL, then that is, you do log in. You set up a login. And as we're looking at this, one of the first things that I want to demonstrate for you, this is what the page will look like when you log in. It has great information. You need to take some time to read through this, familiarize yourself with this. There are some tutorials that click here for free training. So we encourage you to go through that free training. There will be some lectures recorded for you showing you how to use this. There is a user manual that is in PDF. Basically, when I hover over coding, these are the different classification system and resources that are available to you in this software. And I would expect you to be using HCPCS. I would expect you to be using ICD-10, and also to be using the CPT resources. ICD-9 is no longer used. I would not expect you to be using ICD-9 at all. Those codes are out of date. We began using ICD-10 October 1 of 2015. You should be using the ICD-10 diagnosis codes, and you would typically find those by going into the index. And we'll go there in a minute. The ICD-10 PCS codes are used for hospital inpatient procedures. And I would not expect you to be coding from the procedural coding system in an office setting. Those procedures are coded using CPT, which is part of the HCPCS system. If we go into ICD-10 CM and go into the index, We have some different options here. We have the index to diseases and injuries. There is a specific neoplasm table. There is a table of drugs and chemicals, and an index to external causes. In this course, we're providing you an overview of medical coding. And I would expect typically that you're going to spend most of your time learning CPT and learning some of the common ICD-10 codes. You'll be using ICD-10 outpatient coding guidelines as well. The guidelines for ICD-10 are broken down to, in inpatient, there are inpatient guidelines, and then there are specific outpatient guidelines. If I click on the index to diseases and injuries, you can see it comes up like this, and you're wondering, oh my gosh, why would I do that? Well, when you're using the index, you're actually going to be looking up terms, or I could actually click on a specific letter of the alphabet. And if I click on P, then I can see the alphabetical index for all of the diagnoses that start with the letter P. I could scroll down there, but the easiest thing for me to do is to attempt to look for it. And as an example, I'm going to look up pneumonia. And I'm going to hit the search button. And now the index takes me directly to the term for pneumonia. This is a main term. These are subterms. The default code for pneumonia is J18.9. If there were a specific type of pneumonia I was looking for, such as aspiration pneumonia, the code would be J69.0. And so as part of the lectures that you'll be provided with and in working with this software, you'll learn how to use the indexes, the alphabetical index, to look up these codes. Now that is going to conclude this orientation lecture for this course. There is an associated quiz that you will need to complete as well. If you have any questions, please do contact your instructor.